Hello, this is Aaron Shoemaker, and I'm here today to talk with you about one of the services we provide within St. Vincent, which is the St. Vincent Hospice Service. Joyce Rattay is the St. Vincent Medical Group Hospice Liaison, and she's kind enough to join me today to talk about those services. Joyce, tell us about our hospice service.
Our hospice services are provided in Indianapolis, Anderson, Kokomo, also includes Pendleton, the Frankfort area. Those services are provided to patients where a physician would certify them as having 6-month life expectancy or less. And also the services can be provided by that physician or hospice physician, or if the patient chooses, they can have their own physician follow their care.
Either way is okay?
Yes.
Okay. And then they just recertify after 6 months if things go well?
They do, yes. Okay. And it's a lifetime benefit that the patients have. So, we have patients that graduate from hospice, and we have others that continue with the hospice and have been with us for a while.
And you can offer that to any family who might need it, and they can decline and come back later, correct?
Absolutely. Okay. Yes, absolutely.
Very good. And we talked about where we have this is regional. I think we would say too, if there are regions outside of that are interested, let us know. We can start to look at what we can do in the future, because it's something we'd like to offer all our patients eventually.
Yeah, definitely.
What could our doctors and advanced practitioners be better at in referring to hospice?
Probably the number one thing that we see would be earlier referrals.
Okay.
Again, as we said, the benefit is there, and it's very sad when you have a patient that only is with us for a few days. That happens very, very often.
Yeah, and I understand that. What else makes St. Vincent Hospice special? I know all of our doctors are using hospice, so why should we use St. Vincent Hospice Services?
Well, number one is our inpatient unit. The inpatient unit is off Payne Road, and we are within a 60-mile radius. We are the only inpatient unit. St. Francis has done something just recently, but our inpatient unit provides that care. It also provides respite care with some of the skilled facilities. We have contracts with those facilities. And the patients, it's not a long-term solution. It is meant to get pain under control, and then we can move those patients back to their home facility.
Great. And we have extensive grief services as compared to
Absolutely,
some other hospice services,
yeah.
correct?
Yeah, absolutely. Great point. We have one of the best grief support systems. By CMS guidelines, we have to provide 13 months of service, and a lot of times it's checking the box. But St. Vincent has a very comprehensive group that follows the support for the families.
Great. It is a great service. How do we make sure that our referrals stay within the St. Vincent network?
Well, number one is to send us your referrals. We make it very simple for you. You can put those through an Athena. Athena is on constantly, so we're able to pull those referrals. We also recommend with hospice, calling is always great. We have a central intake number that's answered, and we can get those referrals right away.
Very good. Joyce, thanks for coming and talking with us today. So takeaways today, we have a St. Vincent Hospice Service. And as with any service that we provide within St. Vincent's, if we use our own service, we can have impact on how that service is provided. We can give meaningful feedback if things need to improve or if we have other ideas. So using our own service will make us stronger and be better for our patients. Thank you.